right. Well, welcome everybody to Gilda's Club Madison's third in our survivorship series this fall or this spring and summer. And we are joined tonight by Dr. Leslie Waltke, who is an amazing physical therapist who works out of her own clinic. And I will let you tell about all that because you do a much better job of telling your story than I ever would. And so welcome everyone, and I look forward to hearing this great workshop, and also following the lecture, we will be stopping the recording for discussion time. So if you would rather hold your questions until you're not being recorded, that would be great. Thank you very much for being here tonight, and I'll turn it over.
All right, good evening, everyone. Pleasure to be here. I'm assuming it's as hot in Madison as it is here in Milwaukee. Yeah, it's a toasty one. So here's the things we're going to go over this evening. One of the big things as a physical therapist that I really talk about a lot is there are so many cancer survivors. A large study came out in 2016 that looked at hundreds of thousands of cancer survivors here in the United States. And upwards of 40% of cancer survivors, people that are done with treatment, are still complaining of fatigue and or pain. And that's just a horrifying number, because if you think that there's 19 million cancer survivors in the US and 40% of them are still having issues, that's a lot of people. And as we'll learn, sometimes cancer's effect on the body, even if you're cancer-free, can be permanent. But a lot of the stuff that people live with can be made to go away. And exercise and rehabilitation are a huge piece of that. So of that 40%, my guess is that 90% of that 40% would go away literally with exercise and physical therapy, probably in a matter of weeks for most people. So I'm glad to be here tonight to talk to you about this, because pain and fatigue do matter. They are the biggest symptoms during cancer treatment and certainly in survivorship. So they matter because they have an impact on life. So we'll talk about that. Then we'll discuss how the body impacts, or surgery impacts the body, how chemo and radiation impact the body, and then what to do in survivorship as far as what am I supposed to do? Okay. So I hail from Milwaukee, but the first thing I'm going to say is I'm a graduate of the University of Wisconsin. So go Badgers. So Madison, I know you guys are from all over, but Madison is your home base, and it's certainly a home base of mine as well. So, and I graduated from the University of Wisconsin in 1988, back in the Don Morton era. Anybody else from there back then? It was awful. We lost every football game. It was just terrible. It's painful, the painful era. So I am, we don't need to go into detail on this, but I've been I've been a physical therapist for more than 35 years. And I've worked in, specialized in cancer for almost 28 of those years. I am the cancer rehab coordinator for Advocate Aurora Health, which is one of the largest cancer centers in the country. And then I do some teaching and continuing education courses for physicians and physical therapists all over the country and all over the world. And one of the things that I'm really excited, because it's for you, all that other stuff I do for professionals, but I have a Facebook and YouTube channel called The Recovery Room. And I will talk to you more about that. And then I also have a subscription membership called Recovery Room Plus, which is more in depth. So I'll talk to you about that at the end. And I have a fun little offer for you for taking the time to hang out with me tonight. So again, pain and fatigue matter for multiple reasons. First of all, it's awful. Even if they're mild, it is very wearing physically and psychologically. So pain and fatigue can impact psychological health, physical health. And then for people that are still in treatment, whether they're still in their adjuvant treatment or if they've got metastatic disease, how healthy someone is, how much they move, will impact how much treatment somebody can get and what treatment options they can have. So that really matters. So when it comes to the psychology of all this, again, even if you're in treatment or have metastatic disease, or you're a survivor who just isn't as healthy as you used to be, I think people have this underlying assumption that, well, I've had cancer, I'm supposed to be miserable. And that needs to just get tossed out the window. Right. Now, you may not, and a lot of times people can't get back to 100%. And that's for many people, that's what we would expect. But even for people that can't get to 100, well, let's get you to 90, or let's get you to your optimum. I will always say that you are too important to be living below your optimum. So ditch any expectation that things shouldn't be okay for you, because that's not fair. Depression is real. Depression is exhausting. Anxiety is real. Anxiety is exhausting. So all the pain, the fatigue, it just gets people into a negative feedback loop. And pain and fatigue, it can be a reminder that you have or have had cancer, and you don't need that for sure. And then it also can be worrisome that something new is wrong. And again, you don't need that. And then when it comes to physical health, pain and fatigue will impact function, activity tolerance, how well do people do at work. So we know that it decreases quality of life. But there's a lot of data now too that excessive pain and fatigue also may negatively impact length of life. So people just don't, if they're not as active, they don't feel good, they don't get out as much, they don't get as much treatment, they just don't live as long. So it does really matter. So if any of you are still in treatment or are in long-term treatment, there are two things, two big buckets that your medical oncologist uses to judge how likely your body can handle chemotherapy. One of those things is your ejection fraction, and that's when they test your heart. They usually do that before chemo. And ejection fraction is how much it measures the strength of your left ventricle of your heart, the big heart muscle. So it's the amount of blood that it pumps out every time it squeezes. That gives your medical oncologist a good idea of how healthy your heart is. Another thing they will use to judge how much chemotherapy you might be able to tolerate is your performance status. And that is a number 0 to 5 of how well you function during the day. So a normal person with normal functional tolerance is a 0. It's the only time we want to be a 0. And then if you can only function 75% of the day, you're a 1. If you can only function 50% of your normal day, you can't get out of bed, you're a 3. So it gives you a number. So the thing that I want to point out, though, is that ejection fraction, your heart muscle, and your performance status are both modifiable. So you and your physical therapist, or you and your exercise trainer, and you and your just workout routine can improve your ejection fraction, and you can improve your performance status. So that's why we think that people who have long-term cancer live longer, and people that are healthier live longer after cancer treatment if they're in better physical condition. So I literally say, one of my famous quotes is, exercise like your life depends on it, because it does. It literally does. When we talk about exercise, and we'll get more into this, we'll talk about aerobic exercise, strength exercise, and flexibility exercise. So aerobic exercise is any activity that forces your heart to keep pumping a little more than usual for an extended period of time. So it can be 5 minutes, 15 minutes, 20 minutes, half an hour, 30 minutes, an hour, 3 hours, 10 hours. That's aerobic activity. Strength exercise is anything where you lift or push or pull that requires muscular strength to move something, right? That's strength exercise. And we would do that to increase the strength of our tendons, our muscles, and joints. Flexibility is, and we'll talk a lot about this when we talk about cancer surgery. So flexibility is how well does your skin move? How well does your connective tissue move? How much flexibility do you have in your hip joints, your shoulder joint? That too matters a lot. So I need to move my little thing here. So the data, again, the data is very clear. There are thousands of studies now that confirm that exercise during and after cancer is safe, and that it reduces cancer-specific mortality. So if you are a cancer survivor, all right, it can decrease your specific cancer-specific mortality or the chance of dying from cancer by up to 44%. Then it also reduces all-cause mortality, which means that it decreases the risk of dying from all the other crap that people die of. For most cancer survivors, believe it or not, die of heart disease, because that's the #1 killer in the United States. And for people with breast cancer, prostate cancer, and colon cancer, exercise of 3 hours or more a week reduces the risk of recurrence of those cancers. So again, it's breast, prostate, and colon. And that's huge because that's the whole point of going through treatment in the first place, is to reduce your risk of recurrence. So those are massive numbers. So again, exercise has been shown, again, evidence-based research to increase quality of life, improve length of survival, and decrease risk of breast cancer recurrence, prostate cancer recurrence, and colon cancer recurrence. All right. It also decreases fatigue. The only evidence-based treatment for cancer-related fatigue is exercise. I will repeat, the only evidence-based treatment for cancer-related fatigue is exercise. And yes, your doctors and nurses know this. Some are better than others at getting you off to a PT or getting you exercising regularly, all right? But they know this. Exercise helps people stay on their treatment better, okay? Some chemotherapies are hard on the heart. Exercise is cardioprotective, so it can actually help people protect their heart when they're getting some of these drugs. Exercise decreases pain. And again, there's clear data that exercise, regular exercise, improves overall mental and physical health. Okay, so what does that look like? Okay, now the first thing I'm going to say is you have to reframe, and some of you may be exercisers, some of you maybe not. I know you guys are all kind of different, but you have to reframe in your brain what you think exercise is. Okay. So it will be moderate exercise is what we want you to be doing. Now that is going to be moderate for you, not your grandparents, not your kids, not what you used to be before your diagnosis or your surgery, what you can do right now. All right. And again, if you're in treatment or early post-treatment, as you know, your energy level can vary hugely from day to day. So some days, moderate exercise for you might be walking a mile or two. And on days when you just don't feel well, it might be walking a block. That still constitutes as moderate exercise. All right. And again, exercise, your moderate is going to be very different than somebody else's. So you just have to, again, put that all aside about, well, I used to do this and I used to do that. That doesn't matter anymore. What you got to do is what you can do right now. All right. So the research says that for cancer survivors should be exercising in the 150 to 300 minutes per week range. Okay. So that is 2.5 hours to 5 hours per week. Okay. And I think I have a slide coming up that there's 10,080 minutes in a week. So we can certainly find 150 of them to devote to our health and longevity. All right. So the combination that people should be doing of exercise is a combination of aerobic exercise and strength exercise. Aerobic exercise, we should be doing 5 to 6 days a week, and strength exercises twice a week. Okay, unless you're super, super weak, then maybe we bump that up to 3 times a week. Okay, so do some kind of aerobic activity. And again, it doesn't matter what you do, where you do it, or how you do it. All your heart and lungs need to know is that they need to pump a little bit harder. So if you march in place for half an hour, more power to you. Now, if that's really boring, you're not going to want to do it the next day. So you've got to find something that's accessible to you and that you like, because all of us are human. And if you are forcing yourself to do something that you don't like or doesn't feel good, you are not going to keep doing it. So make sure that it doesn't have to be enjoyable, but it should be kind of fun. Whether if you're going to take your walk, through the woods or on a path or through the arboretum, just make it enjoyable and make it easy. There's no rules that it has to be hard or unpleasant. And then as far as the strength exercises, we want you to do some strength exercises for your legs and some strength exercises for your arms twice a week. Okay, you can do arms and legs on the same day. You can do 2 arm days and 2 legs. It doesn't matter. Okay, it can be something as simple as going up and down the stairs, sit to stand from a chair, squats against the wall push-ups. Again, you don't need fancy equipment. And you don't have to be beating the crap out of yourself with 3 hours of exercise. You literally can do strength exercises in 5 or 10 minutes in the comfort of your own home. And I will, Kirsten, I'll get you, a link to one of my recovery room videos on strength exercises for home.
Thank you so much.
I'm making a note because I'm not going to remember if I don't write it down. Fully admit it. All right. Okay, so what's not okay, whether you are in treatment or not, it is never normal to have shortness of breath with minimal activity. Okay, so that is definitely something you would want to talk to your doctor or nurse about. Okay, uncontrolled pain, again, is not normal and would need to be reported to your doctor or nurse. If you are in treatment or post-treatment and you are not able to control vomiting, nausea, your appetite or diarrhea or headaches or something that you can't control, again, not normal, and you should contact your doctor or nurse. Also, if you are having trouble with anxiety or nervousness or inability to sleep or ongoing depression, again, that is not normal, okay? Just because it's common doesn't mean that it's normal. All right. And just because it's expected doesn't mean that we can't address it to either make it less or make it go away. Okay. And another thing I will tell my patients is, because you got a bunch of stuff going on, you got a bunch of doctor's office, everything hurts, everything itches, everything's dry, everything's awful. So you go in with this list of complaints. But I will remind you that you are not complaining to your physician. You are telling your physician about your symptoms. Okay. So that's really important. So we want you and encourage you to tell your team everything, because we can't fix what we don't know about. Okay. Now you may get the, nothing we can do, or here's a pill, but at least they need to know. All right. So let's talk about cancer treatment a little bit and its effects on the human body. First of all, cancer treatments are kind of lumped into two major broad categories. There's local treatments and then there's systemic treatments. So local treatments are treatments that treat right over where the cancer is or where the cancer was. So surgery and radiation are local treatments. So if somebody has colon cancer, they have local surgery to remove the colon, that part of the colon. If somebody has, in this example, somebody has breast cancer on the left side, radiation is a local treatment to where the tumor was after surgery. Okay, that's local treatment. Systemic treatment, like the name sounds, treats the entire system. Okay, so systemic treatments are chemotherapies, biological therapies, targeted therapies, hormonal therapies, immunotherapies. Those are systemic treatments. So when you look at the side effect profile from cancer treatment, when you've got your local treatments, which again is surgery and radiation, again, these are very common and most people will have more than one of these, okay? So pain and swelling, loss of range of motion, strength loss, we'll talk about soft tissue tightness and restrictions. And then if you have had lymph nodes removed from your underarm or your groin, or radiation to the underarm or radiation to the groin, you are at potential risk for infection in that area and lymphedema, okay? And then from systemic treatment, again, your IV and your oral drugs, fatigue, bone loss, muscle loss, neuropathy is huge. Weight gain and weight loss are very, again, depending on what type of cancer you have and what type of chemotherapy you get, postural changes, and again, just a massive impact on your ability to function normally. Again, very, very common. And that slogan, cancer sucks, this would be why. It's terrible. It's just terrible. Okay. So that's why, your cancer team should be getting you to a physical therapist. And if you haven't seen one yet, it's never too late. But if you were to have a stroke, if you were to have back surgery, if you were to have foot surgery, or a total knee replacement, or a heart attack, you would get sent to a PT. Okay, so people with cancer have bigger side effect profiles than a lot of those other people do, and they just don't routinely get sent to physical therapy. We're working to change that. So please ask for a PT referral if you're still dealing with some of this stuff. All right, so let's take a look at cancer's impact on your body. I'll give you a little bit of a trigger warning. I'm not going to show you anything really disgusting or anything, but I've got a couple of surgical pictures in here just to let you know. So now this is a chest wall, and I know that not everybody has had chest wall surgery, but this is just a great example of if you remove the skin, here's the chest wall muscle, the pec major, all right, that underneath our skin, again, whether it's the axilla, the underarm, or the groin, the concept is going to be the same, that if the skin gets tight or the muscle gets tight, it is going to obviously maybe perhaps impact the range of motion at the hip or the shoulder, okay, or at the spine or wherever. But there's nerves and arteries and lymphatic vessels that have to run underneath all those muscles and all that tissue. So if that skin and connective tissue isn't moving normally, it's going to compress that stuff. It's going to cause scar tissue and it's going to hurt. And possibly, again, not only just limit range of motion, but compress the underlying lymphatics. So now I'm going to show you a surgical picture. Oh, no, I guess not. So this is another scar tissue picture. So this is Nancy. This is her normal, unaffected right underarm. And this is her left underarm after a lymph node removal. So you can just see how tight that is. Okay, so same concept again, whether you've had lymph nodes removed from your abdomen, your groin, your underarm, things, you cut the human body, it just tends to get really, really tight. Now I'm going to show you that surgical picture. Okay, so this is a left chest wall after the breast has been removed. So this muscle, you're looking at the pectoralis major muscle, is right here. So skin and muscle. So one of the biggest differences between a cancer surgery and orthopedic surgery, like back surgery or a knee replacement or shoulder surgery, is that an orthopedic surgeon goes in and fixes something and then closes, all right? A cancer surgeon goes in and takes stuff out, okay? Ovary, colon, breast, prostate, whatever it is. They take stuff out, okay? Then they have to sew it closed. So already there, you're looking at an increased propensity for scar tissue. And then a lot of cancer surgeries will be followed with radiation to the same area, which then increases even more the amount of scarring and tightness that you may have, right? So this is somebody who literally is about 30 seconds post-mastectomy. The person's still on the operating table. Here's that same chest wall a year later, okay? So this, my friends, is scar tissue. And scar tissue is something that you can't control, your surgeon can't control, your physical therapist can't control. It's a normal physiological healing process. So all of this white and yellowy stuff is scar tissue. So there's the pectoralis major, okay? And the skin and the muscle can kind of stick to each other. But here's what I want to point out though. So you can see if somebody's had surgery and they don't move and stretch, that scar tissue is going to heal really, really tight and maybe very restrictive in blocking lymphatic flow, blocking blood flow, making it harder to move, and it can hurt. This woman was a patient of mine, okay? So during this scar tissue maturation process, she was stretching and moving and strengthening. She was very active. So this woman, even in the presence of all this scar tissue, had completely normal range of motion. The skin moved really well. She had completely normal strength and normal function. Matter of fact, she was above normal functioning. She was very strong and actually was a third degree black belt in Taekwondo. So, but again, that's the importance of moving after surgery and radiation, is to keep all of this tissue lengthened and stretched and mobile. So again, common post-surgical problems, pain, decreased mobility wherever you had the surgery, again, whether it's the abdomen, the back, the groin, or the chest, decreased strength, scar tissue, postural changes, again, loss of function. And again, if lymph nodes were removed, that arm or that leg may be at risk for lymphedema. So what we want to do then is get somebody on a pretty regular stretching routine for whatever body part was impacted by the surgery, whether it's the rib cage from lung surgery, whether it's the pelvic floor, whether it's the chest wall or the axilla, the colon, the abdomen, whatever it is. So ideally, remember we talked about the difference between range of motion. So maybe your hip joint moves completely normally, but the skin in your inner thigh is super tight, or your shoulder moves normally, but you've got super tight tissue in the abdomen or the chest wall, which still hurts. So remember, range of motion and tissue flexibility are two different things. So just some very common stretches for somebody who's had some kind of cancer surgery above the belly button or radiation above the belly button. Just so stretching the chest wall and the lateral chest wall. Another nice, and again, it's better to stretch lying down because then you've got gravity helping you and you can't cheat. All right. This is a gentleman who had a rectal cancer surgery. So again, just stretching the abdomen, stretching the pelvis area. Here's a woman who had ovarian cancer, just very, very tight in the abdomen. So just getting on her belly and working on stretching. All right. And then again, for anybody who's again has had chest wall surgery, whether it's breast, melanoma, lung, again, we want people to really have good length of their skin in that area. Okay, so let's take a look at chemotherapy. So as you know, it's a systemic treatment, and traditional chemotherapy is what we call cytotoxic. It's designed to kill rapidly dividing cells, which the good thing is that cancer cells rapidly divide, so they die, which is great. But other rapidly dividing cells include cells of the bloodstream, which is why you may get low platelets, low white count. You might get anemic. Our hair follicle cells actually reproduce quickly, which is why people may lose their hair. And the cells of the gastrointestinal tract rapidly divide, so they get smacked by most chemos as well. So again, that's nausea, diarrhea, all that other, and constipation. And as I mentioned, some chemotherapies, many of them are actually hard on the heart, and that is called cardiotoxic. And again, exercise has been shown to protect the heart from some of that harsher chemotherapy. All right, so for a list of problems post-chemotherapy that are physical, okay, fatigue is number one. So muscle wasting, bone loss, neuropathy is huge. It can decrease your cardiac function, again, weight gain or weight loss, depending on what type of chemo you're getting, anxiety and depression and loss of function. And guess what? We'll talk a little bit more about neuropathy at the end. But with the exception of neuropathy, exercise can minimize, reduce, or eliminate all of these things. Okay, so it's really, really important. And it's hard to tell somebody when you feel like hell to get up and take a walk. That's honestly the best thing that you can do. And if you say, I can't walk 5 minutes, then you walk 4. If you can't stand for a minute, then you stand for 30. Just do what you can when you can. And cancer-related fatigue, again, is rated as the most common side effect by patients, and it's also reported as the most distressing side effect of cancer patients. So it's a double whammy. It's very common, and it's one of the most distressing to people. And cancer-related fatigue, as I'm sure you are well aware, is not relieved by rest. Right? So you go to bed feeling crappy, you wake up feeling like crappy. It is so common that it's anybody that's going through surgery or radiation, or chemotherapy or radiation, 70 to 100% of people undergoing those treatments are going to complain of fatigue. It is literally that common. What's unfortunate is when the treatment's done, 30 to 50% of people continue to complain of fatigue after the treatment's over. All right. And again, if you are more than 6 to 12 months out and you are still dealing with fatigue and you don't feel like you're normal yet, I would definitely get to a PT and have them build you an exercise program, because that's what's going to help get you out of that. And as I mentioned earlier, the only evidence-based treatment for cancer-related fatigue is exercise. Okay. Yes, if you have an infection, they're going to treat that. Yes, if your heart isn't pumping normally, they're going to treat that. Yes, if your thyroid is off a little bit, they're going to treat that. All right. Yes, you need to be eating well, you need to be sleeping well, but the only thing that really fixes fatigue is exercise. So again, what you choose to do doesn't matter. You can walk, you can run, you can jump up and down on a rebounder, you can swim, you can cycle, you can dance, you can rollerblade, you can kayak. It doesn't matter. It may be up to where you live, what you like, and physically what you can handle, or where you're at in treatment. If you've got a low white count, we don't want you in the water. We certainly don't want you at the gym. But you can find something that works for you. All right. And if you're struggling with that, again, a PT can help you find things that work for you. But wall push-ups are great. sit to stand from a chair, standing on one leg with your eyes open and closed, going up and down the stairs, or just going up and down one or two stairs is great exercise. And this is also important to note that regardless of how low somebody's blood counts go, exercise has still been shown to be safe in that scenario. So people who have stem cell or bone marrow transplants, okay, their numbers literally go down to zero. They kill everything. And those people are in isolation. They have exercise bikes in there. Those people are exercising, right? So even though your counts are low, doesn't mean you get the day off, all right? It may mean you modify what you're doing. All right. As I mentioned earlier, if your white count is low and your medical oncologist says, I don't want you going out in public, you don't go to the gym, you don't go mall walking, you don't go walking with 10 friends. OK, you can still exercise at home. You just have to protect. Exercise is safe. You just have to protect yourself from getting an infection. OK, so you don't go in the lake and you stay away from people, but you can still exercise. If you have low platelets, you can still exercise. You may need to modify what you do because we don't want you falling and we don't want you bleeding. So you're not going to do any high intensity stuff. You're not going to do any aggressive stretching or aggressive weightlifting, but you can still take a gentle walk when your platelets are low. All right. And even if somebody has severe fatigue, doing 2 to 3 minutes of exercise 2 or 3 times a day is absolutely fine. And it is actually beneficial to do that. So if you're in a zone where getting out of bed is difficult, you sit on the side of the bed for 5 minutes. That can constitute moderate exercise for someone who is severely fatigued. Okay. If you have mild to moderate fatigue and you can run 3 miles, more power to you. Okay. So as I mentioned, and something I'm going to tell you is anything is better than nothing. Okay. So doing nothing is not going to get you stronger. So sitting on the couch, there are times when your body needs that, but remember that sitting on the couch is never going to make your muscles stronger. It's never going to make your heart stronger. Recovery and rest are important. Okay. But if they are not equalized by activity and strength and aerobic exercise, you're going to get in trouble. You're going to just get weaker and weaker. All right. So yes, anything is better than nothing. And slow is better than no. Those are my 2 caveats. Okay. And again, if you've been generally healthy and you are generally somebody who's really active, it can be kind of a psychological blow to think that walking to the mailbox and back is exercise. But it is. Okay, it really is. And if you do want to get back to the tennis court, you do want to get back to hiking and stuff, you've got to start at rung 1 of the ladder. You're never going to get to hike again if you don't get up and just stand. Okay, so people just want to go back to rung 10 of the ladder, and you got to start on rung 1. You just have to. All right. So give yourself a psychological break. And I know it's absolutely not fair, but it's the best places to start is at the beginning. So slow is better than no, and anything is better than nothing. Okay, then when it comes to strength exercise, I will have you follow what I call my 10 to 30 rule. People say, I don't know how much weight I'm supposed to lift. So they don't do anything. Okay, so what I will say, if you are picking up a weight or you put a pin in a machine or you've got a TheraBand or something, if you can't do 10 repetitions in a row, it's probably too hard. Okay, I want you to be able to at least do 10. On the other end of the scale, if you're ripping off 30 repetitions and you're not feeling much muscle tiredness, it's probably not enough. So if you stick somewhere between 10 and 30 repetitions, you're pretty golden. Okay. And again, we want you doing exercises for both your arms and your legs. And again, the same bullet point, anything is better than nothing. Okay. And you don't need to buy new fancy shoes. You don't need to buy workout clothes. You can take a walk in blue jeans. So again, anything's better than nothing if you're starting from square one. All right. And again, as I mentioned already, exercise should be your moderate, not somebody else's, your moderate on that particular day. And that can change. So it is okay one day to do a walk to and from the mailbox, and other days, maybe 3 days later, you're walking 3 miles again. Okay. So do what's moderate on that particular day. All right, so let's take a peek at radiation. So here is the linear accelerator. So we're talking about external beam radiation, where the radiation comes out of the machine through the body and then either into the floor or the wall. And again, here is a chest wall that's just completing radiation. So you can see how if this shrinks with time, the radiation fibrosis, that this chest wall skin will get tight. And again, we don't want it to compress the muscle underneath here. We don't want it to decrease the amount that the skin moves in the underarm. So you can see she's got normal range of motion here. All right. But we want her to keep that. So this person, anybody who's been through radiation, should be stretching for a good year to a year and a half after the conclusion of the radiation, because both scar tissue after surgery and radiation fibrosis after radiation, it takes them it's like slow setting cement. It takes like a good year to a year and a half for it to kind of finally stop shrinking. It's like getting shrink wrapped. People just feel super, super tight. All right. So even with normal range of motion, we want people stretching for a good year, a couple times, maybe 3 or 4 times a week, just to maintain this tissue length as it starts to heal and scar. All right. So post radiation, it can decrease mobility of wherever that radiation was. So again, whether it's at the rib cage, the spine, the groin, the anterior thigh, the chest wall, it can cause pain. Okay, the scar tissue and limited mobility can cause pain. If people have had radiation to the breast, they can get breast lymphedema. But again, that soft tissue tightness, and then eventually the radiation doesn't necessarily specifically cause the weakness in the muscle underneath. But if you're not moving normally, after a year or so, that muscle underneath is going to get weak. Okay, so if it's the pectoralis major, the quadriceps, the hip flexors, the spine muscles. And again, radiation is well known to cause fatigue. So what we do for people in radiation then is, again, we want a range of motion program for the joints in the area. Again, whether it's the spine, the hip, the pelvis, the ankle, the knee, the chest, the shoulder, depending on where you're getting radiated. So people are going to do stretching. They may need some physical therapy. And again, we want people on a strength program for 2 reasons. Number one, because we know strength exercises help combat the fatigue with radiation, as does the aerobic exercise. Okay. But again, a strength program should be long-term for at least a year or so for whatever muscles are underneath the radiation field. Again, whether it's the pelvic floor, if you've been radiated there, the rib cage, the spine, the shoulder, the groin, whatever. Okay, so let's talk quickly about survivorship. So what the data says that anyone diagnosed with cancer should be exercising 150 minutes per week. Okay, so that's 2.5 hours of combined aerobic and strength exercise. So 150 to 300 minutes, anywhere in that range is good. And again, strengthening twice a week, arms and legs, and then doing some type of aerobic exercise 5 to 6 days a week. And again, that is a huge commitment, especially if you're taking care of parents, you're taking care of kids or grandkids, you still got a job, you got a house. It's a lot. Okay. But I will remind you again that there's 10,080 minutes in a week. And your health and your ability to function and your ability to live long and live well completely depends on your physical health. So carving out 150 minutes per week needs to be a number one priority for you going forward. It just has to be. You will sleep better, you'll be stronger, you'll be able to more tolerate the stress, and you're just going to be a physically healthier, happier, stronger person. And you deserve that. Okay, so as I mentioned, most chemotherapy drugs for most types of cancers have the potential to cause neuropathy, okay, in the hands. That's the numbness and tingling and pain in the hands and feet. And for about 50% of people that get that during treatment, it may go away after treatment's over, but for a lot of people, it doesn't go away. It just stays. It gets a little bit better, but it just sticks. So people 10 years later, they say, yep, I still can't feel my fingertips, okay, or my toes. So, and then arthralgias and myalgias are pain in the muscles in the joints. So if anybody on the call is taking an aromatase inhibitor because they have had hormone positive breast cancer, that's what that is. So let me talk about those really quick. So from neuropathy, from the chemotherapy, exercise is not going to significantly make that pain better. Okay. If you have neuropathy, it's kind of a bummer because you're probably always going to have neuropathy. So your options are, first of all, knowing that even though exercise might feel like it's making it worse, it's not going to damage the neuropathy. It's not going to make it better, but it's not going to make it worse. But if people stop exercising or stop moving because their feet and their hands hurt, then they're going to get weak. Okay. And that just, again, makes everything worse. So I will tell people you can be, have numbness and tingling and be miserable, or you can have numbness and tingling and at least be out in the community, spending time with your family, exercising, doing stuff. All right. So we teach people how to move with neuropathy. All right. Because if the neuropathy gets bad enough or weakness gets bad enough, all of a sudden people have trouble getting up and down the stairs. They have trouble balancing, putting their clothes on. And we don't want that to happen. All right. So with neuropathy, if it's bad enough that you find yourself, I can't do it because it just hurts too bad, that's when we would ask you to try some medications. Again, there's not a pill that will fix the neuropathy, but there are some medications like gabapentin that can mask the neuropathy, just kind of calms your nerve endings down. For some people, it works great. For other people, they try it. They're like, this is not doing me any good. And the side effects from the medication are terrible, but you're not going to know until you try it. So there's no reason but just know that it's not going to fix the neuropathy. But if the cost to benefit ratio, side effects versus what benefit you get out of it, try it. And then if it doesn't help you, then you can stop the medication. Now, if you are an aromatase inhibitor and you have those muscles and joint pain where you feel arthritic and you feel pain in your joints and muscles, exercise actually does significantly reduce that pain. Okay, so exercise is the best medication for that type of pain. So often it can reduce the amount of pain people feel by 30 to 75%. Sometimes it makes it completely go away. And that pain will stop when the aromatase inhibitor stops. Okay. All right. So if you are living with chronic pain or fatigue, again, what do we do about it? Medications, physical therapy, stretch, strength, aerobic exercise, balance and functional exercises. So even in the presence of pretty crappy symptoms, you deserve rehabilitation and you deserve to feel better, or at least your maximum. Whether you can get to 100%, that might be possible. If we can get you to 70, 80, or 90, that's a heck of a lot better than 40 or 50. Okay. And then pain from radiation and surgery. Again, physical therapy, stretching and strengthening, which is what we recommend for people who've been through those cancer treatments. And then again, for fatigue, the best treatment for you is going to be a combination of aerobic and strength exercise. So talk with your cancer doc or nurse, or keep in touch with your PT if you haven't, but you haven't talked to him or her in a long time. Give them a jingle if you're still having issues. All right, so I'll put my quote up here again. Exercise like your life depends on it, because it does. And again, I think in middle age, we all get busy taking care of everybody else, and we have full plates. It's a very busy time of life. But you are literally the most important person on the planet. So you've got to put your health and your physical condition as a number one priority. Okay. And then real quickly, I want to tell you about the recovery room. So the recovery room is a social media channel that I have. It's found on Facebook and YouTube. It's completely free. And there are hundreds of videos there that I've done for patients, people that live with cancer, either during treatment or after. They're short, they're positive, they're easy to understand, they're medically accurate. And they're on, they describe cancer, they teach about cancer treatment, and they teach about cancer recovery and how to physically make yourself stronger. All right, so check that out. And then I have a special offer for you tonight. So I also have, that's my free site. I also have what's called Recovery Room Plus, which is a membership plan. And when you do that, it's a monthly fee of $23.45. But with that, what you get is direct interaction with me. I have you get closer expert with doctors and nurses And then you get, again, expert connection, which you guys are already getting with Gilda's Club. But just to give you an idea of what it offers. So every month I do put out videos. The muscle of the month this month is rotator cuff. So every month we have a different muscle, because again, it's important to understand your body and your joints. So the better you understand your body, the better you can take care of it. So we have the muscle of the month. We have the expert show where we bring in an expert and I do interviews. This month's interview was with a cancer dietitian. We talked about cancer and sugar, and all the myths surrounding that. We talked about organic eating, the myths and the facts. We've had people talk about chemo fog, weight gain. We've had experts on genetics. And then we have member meets and metastatic member meets for people to get together and talk. Then I have random favorites for my car, where I just literally do something fun for my car, where I share a little bit more about myself, or some favorite clinical story, or some kind of favorite something related to cancer in life. We do a monthly journal prompt for everyone. Then we also have Books for Better, where I bring in an expert and we have either a virtual or a live book discussion. This next book we're talking about is When Bad Things Happen to Good People. So we're talking about that on the 2nd of August coming up. We do books like that relate to cancer. We did When Breath Becomes Air. And then we do other things too, like Kirsten was talking about building resiliency. We did a book review on grit, which is all about how do you build your strength when you've been kicked in the teeth 1,000 times. So that's really cool. And then I have my patio impact series, where I literally have cancer survivors, come to my patio, and we interview them and we just talk, and everybody learns so much from those conversations. So the tagline of that, it's not about cancer, it's about people affected by cancer. So that's a great thing. And then what I really love is open mic night, where everybody gets 5 minutes on a virtual call to answer a specific question, or we talk about a specific topic. Sometimes they're very serious, like what is your biggest fear? Sometimes it's how do you deal with the holidays? Sometimes they're funny, like what is the stupidest, funniest thing anybody ever said to you after your cancer diagnosis? So it's something different every time. And those are really cool. So that's Recovery Room Plus. If you are interested, I'm offering to my lecture people like you guys a 30-day free trial. So it will cost you nothing. So what you do is go to recoveryroomplus.com, and then you have to make it a little account. And then when you go to the checkout page, when you put Gilda 30 free in the discount code box, it wipes out your total to zero. And then you can check everything out. You can see all of the expert shows for the last year. You get access to you get access to everything, all the live events. You get access to the Facebook page if you want it. And then if you like it, you need to do nothing, and you're in. You'll just start getting charged $23.45 a month. You can cancel anytime after that. Some people stay for 3 months. Some people have never left. But if you don't like it and you're like, no, this isn't for me, that's absolutely fine. If you cancel the membership, and it's really easy, we'll send you a reminder email at day 25, and we'll show you exactly how to cancel. It's super easy. You pay nothing. It won't cost you a dime. Okay. So it certainly is a no risk free way to take a look at the membership. All right. So again, thanks for your time. I am happy to take questions now. And I will stop sharing my screen so we can all see each other better.
And I will stop recording.
All right. Thank you, everyone. I'm glad to talk to you. I'm going to hit the stop button here.